For today's assignment, we'll be focusing on how to apply a splint and the proper process of applying an arm sling and swathe for arm injury, particularly the forearm. The first step is to activate the Emergency Medical Service System, or EMS system. First, check for responsiveness in a motionless person by tapping their shoulder and asking if he or she is okay. If the person does not respond, an example, does not answer, move, or moan, he or she is said to be unresponsive. This is to satiate the concept of applied consent for working on a person. Thus, if you can get their consent if they are conscious. Second, after you check for responsiveness, shout for nearby help, which you would activate the EMS system by calling or asking a bystander to call 911. Using a mobile phone, you can call EMS without leaving the person's side. If possible, if a mobile phone is used, it should be kept by the person's side. If possible, if a mobile phone is not available, leave the person to call 911 and get an AED, automated external defibrillator. If you are alone with a child or infant, give them CPR for 5 sets of 30 compressions and 2 breaths, 2 minutes. Then call 911. First, to apply a splint, depending on the type of material you have nearby, if you're in a home, you're most likely to find magazines, newspapers, or pillows. And if you just happen to be a woodworker, then, or just so happen to have the supply, a board. Or splints if you actually have such. And for this one, I'm just going to be using a pencil for board. You could also use cardboard, that also works. But for this, pencil. For this, you must first get the splint and apply proper comfort so the arm is not being, well, pressed against wood. After you have the proper bandaging, make sure that you lay the arm in such where the thumb is sticking up for the forearm. Then rub appropriately around the splint around the arm until it is properly tied to the person's arm, keeping it from bending. Support to keep it, well, straight. Like a tooth bending inside of a person's mouth. Keep it straight with a retainer. Next, to apply the proper, now that we have the splint in place, the proper method of applying, well, an arm sling and swathe for the arm injury. If you do not have a triangular bandage, improvise with such things as a sheet, in this case for me a towel, a large scarf, a jacket, etc. You can use a tiny blanket if you want, just as long as it's applicable for an arm injury. Take, in this case, for the towel, the triangular side, which can apply the triangular bandage, and have the person, if they are conscious, ask if they can hold the arm, and make sure that the hand and wrist are slightly above the elbow in height, preferably about 4 inches up. Then keep it close to their chest, so that whenever you do apply it, it is a little bit easier. Now, you will take the triangular side, put it under the person's arm that they may be holding if they are conscious, and pull it under. And put it above your uninjured shoulder, making sure that everything is straight. Then take the bottommost side, the opposite end of the triangular bandage or towel, and bring it over the injured shoulder and tie it off. Make sure that the triangular bandage and the other side of the triangular bandage meet on the uninjured arm's side, over the shoulder near the clavicle, and tie with a reef knot. And for anybody who doesn't know what a reef knot is, you simply just take it, put it under, pull a little bit, then just, well, tie it off. Next, after tying it off and making sure the arm is nice, comfortable inside the little pocket, making sure that it reaches all the way, you then take this end, the opposite end, and tie it off as much as possible until you are able to feel that nice and tight. Well, you wouldn't be able to feel it until it is nice and tight. To which, then, you take the opposite end with the most left, and bring it over to tighten it even further, without suffocating the arm, of course, especially in the procedure for the splinting. Do not do it too tight, you do not want to remove circulation. And tie it off on the other side, or use a pin, that is up to you, if you have that available. And then once you tie it off, you have the proper, sling and swathe for arm injury, and then keep it in position, a little bit angled, and if you have not called 911 before then, you should have, and wait with the person until the emergency services arrive. Thank you.